Today we're with Dr. Tomah, and we're going to ask Dr. Tomah some questions relating to a condition referred to as adrenal fatigue. So how do you know if you have adrenal fatigue?
Yeah, so it's a really good question. It's a pretty common syndrome, and the main symptoms that people are going to see with that, fatigue being one of them, and this would be really extreme fatigue, beyond just being tired, that feel so tired and burnt out that you can hardly function. It's hard to get anything done. Some people in later stages are going to have difficulty sleeping. They might get something that we call tired but wired. So you feel tired, but then you can't really sleep because you're wired, and this has to do with the cortisol levels.
Do small children give you adrenal fatigue?
Small children can do it.
Is there a way to test for it?
Yeah. So there's a few different ways that we can test for it. So the main way that I prefer to test for it is through urine. So testing cortisol levels in the urine, because when we do that, we can do multiple samples throughout the day. And this is going to give us an idea of the actual cortisol curve, because we'll have every day there's a pattern to our cortisol curve where it should be higher in the morning and it should decrease throughout the day. And so if we measure at multiple points, we can see, is the pattern correct, or is it high throughout the day, or is it low throughout the day, or is it an inverse pattern? So it really gives us a lot of insight into how would we want to address it and treat it.
And I think most people want to know, how do you address it? Like, how do you treat it?
Yeah, so the first step is really diagnosing it properly. So doing some sort of test to figure out where you're actually at, because surprisingly, the symptoms of high cortisol and low cortisol can be quite similar. So it can be hard to differentiate. And if you're doing a treatment that might increase someone's cortisol, if it's already high, they're going to feel more wired, more anxiety. And if it's already low and you're lowering it more, they're going to feel even more fatigued. So you want to really refine the diagnosis by doing some sort of testing. Once you have that information, there are lots of herbs and botanicals that we can use that modulate the cortisol balance. So they help kind of build someone's resilience to stress so that it can improve their energy levels and their actual ability to function. And beyond that, something that without testing everyone could do that's helpful is our adrenal glands in our body craves routine. So if we're going to bed at the same time each day, waking up at the same time each day, exercising and eating at similar times, this helps build routine into our schedule. And the adrenal glands in our what we call the hypothalamus, pituitary, and adrenal axis, the HPA axis, this will be regulated by having that routine.
And what about, I've heard of transdermal cream.
Yeah, there are some transdermal creams. Most of the time we don't really need to get there. The herbs and the botanicals actually work very well. So there's a category of herbs known as adaptogens. And basically these herbs help the body adapt to stress, largely by acting on this HPA axis.
Okay.
Yeah.
Well, if you guys want to learn more, you can have a meet and greet with Dr. Tomah. Give us a call at 604-742-0702. We look forward to meeting with you.
All right. Thanks, Dr. Dan.